Okay, let's unpack this. Um, Imagine you've had a test result. Maybe it wasn't quite what you expected, or perhaps a doctor spots something unusual.
Right.
And suddenly you hear this word can sound a bit, well, daunting.
Mm.
Biopsy.
Mm. Yeah, it can.
Well, it's a really common medical term, though. And while, it might bring up some questions, maybe even worry, it's actually a crucial step. Absolutely key for understanding what's really going on inside your body.
That's so true. Lots of people hear the word biopsy, but they're not totally sure what it means, what it involves, or, why it's even needed sometimes.
Yeah.
So our goal in this deep dive is really to cut through some of that uncertainty. We're digging into the source material we have, patient education, biopsy, the basics, from UpToDate, and pulling out the essential info.
The core stuff.
Exactly. We want you, our listener, to feel, well, more informed, more empowered if this ever comes up.
So consider this our mission, then. Just extracting the most important nuggets from this document, giving you a clear kind of foundational understanding of biopsies, and doing it quickly, turning that potential jargon into useful knowledge.
Okay, so let's start right there. What is a biopsy, according to this source? Like the basic definition.
Right. The source says it's essentially a procedure, a way to check an area of tissue in the body by taking a small sample.
Simple as that, a sample check.
Yep. But why? Why would someone actually need one? What are the common triggers listed in the source?
Ah, okay, the why. Well, the source points to a few main reasons. It often comes up when doctors need more specific information than maybe other tests like imaging can give them.
Right, like an X-ray shows a shadow, but not what the shadow is made of.
Precisely. So the source lists these specific situations. First, maybe you have an illness they can't quite explain, or an abnormal test result pops up, the biopsy helps figure out the cause.
Okay.
Second, they might need it to specifically check for or confirm a particular disease they suspect.
Makes sense.
Third, and this is probably what most people think of if you have a growth or, a tumor, they need that sample to see if it's cancerous or benign. That's critical.
Absolutely.
And fourth, a bit more specific, but after an organ transplant, they might do biopsies to check on the health of that new organ, make sure it's doing okay.
That covers a lot of ground. So it's really about getting that definitive answer right down at the cellular level.
Exactly. And the source is clear that there isn't just one kind of biopsy, which is interesting.
Oh, how does it break that down?
It really depends on what they need to sample tissue or fluid and where it is in your body. The source kind of groups them based on the setting, basically where the procedure happens.
Okay, so let's tackle that first group. The source mentions biopsies done in a doctor's office. What are those like?
Right. So these are usually for areas that are, let's say, easier to get to, often near the surface of the skin or reachable with certain tools without major intervention.
Simpler access.
Yeah. And the source notes that they typically use numbing medicine first, right there in the office, so it's comfortable.
What are some examples they give?
Okay, so they list needle biopsies. Uses a needle, obviously, for a small tissue or maybe fluid sample. Could be a fine needle or a slightly larger core needle, often for lumps you can feel near the skin. Then, skin biopsies. Special tools just for taking a tiny piece of skin.
Right.
Bone marrow biopsies that uses a longer needle, usually into the hip bone, to get a sample of the marrow inside.
Okay.
Cervical biopsies, taking cells from the cervix, the bottom of the uterus, again with special tools, and prostate biopsies, sampling the prostate gland in men.
So things generally accessible without needing, like heavy sedation or a full operating room, seems fairly straightforward.
Yeah, generally less complex. But then there's the second category the source talks about, biopsies done in a hospital, operating room, or procedure area.
Okay, what makes these different? Why the change of venue?
Well, these usually involve getting samples from organs or tissues that are deeper inside the body. Or sometimes the procedure itself is just, well, more involved.
Needs more support, maybe.
Exactly. Could be a more sterile environment is needed or more monitoring. And because they're often more complex or internal, you might need medicines to help you relax, stronger numbing, or sometimes even general anesthesia where you're actually asleep for it.
Right, okay. So what kinds of biopsies fall into this category?
The source gives several examples here. First is a surgical biopsy. This is more like traditional surgery. It means making a cut, an incision, to directly get to the tissue and remove a sample.
Okay, more invasive.
Can be, yes. Then there's endoscopic biopsy. This uses a scope, One of those thin tubes with a camera.
Like for a colonoscopy.
Exactly like that.
Yeah.
They guide the scope inside, could be digestive tract, lungs, wherever, see the area on a screen, and then use tiny tools that go through the scope to snip off a sample.
Clever.
Very. Then, percutaneous biopsy. The name means through the skin, which sounds like the office ones, right?
Yeah, a bit confusing.
But the key difference here is it's for deep tissues or organs. They use a needle going through the skin, but, and this is crucial, they guide it using imaging, like an ultrasound or a CT scan, in real time.
So they can see exactly where the needle tip is going deep inside.
Precisely. Essential for hitting the right spot and avoiding other things. And finally, endovascular biopsy through a blood vessel. This is pretty specialized.
How does that work?
They insert a thin tube, a catheter, into a major blood vessel, maybe in your neck or groin, and thread it through your circulatory system to get near the target organ, like the heart. Then they use a special tool through the catheter to get the sample.
Wow. Okay, that really shows the range. So with all these different methods, how does the doctor actually decide which one is right for you?
Yeah, good question. The source says doctors weigh several things. Your overall health is a big one, naturally.
Makes sense.
Then it's all about the target area itself. How big is it? Where exactly is it located? How deep inside the body? And importantly, what did it look like on any imaging tests you already had? Like that ultrasound or CT scan gives them clues about the best and safest way to approach it.
Okay, that makes sense. It's a tailored approach.
Yeah.
So once the type is decided, how do you prepare? Does the source give like a standard prep list?
It stresses that prep really depends. It's not one size fits all. Depends on your specific situation, the exact type of biopsy, where it is. Your doctor or nurse gives you the specific instructions you need to follow.
Tailored again.
Exactly. But it does list some things that might be involved in the preparation.
Like what sort of things?
Well, you might need to temporarily stop taking certain medicines. Blood thinners are a common one they watch out for.
Okay.
Depending on the procedure, you might have to avoid eating or drinking for, a certain number of hours beforehand, or maybe follow a special diet.
Standard pre-procedure stuff, often.
Pretty standard, yeah. And it also mentions you might get an IV put in that little tube in your vein for fluids or medicines, again, depending on the situation.
Right. Seems logical to ensure safety. Okay, so let's walk through the actual procedure itself. What does the source say generally happens during the biopsy?
Again, it varies, but the source outlines the common steps. You might get those medicines we mentioned for pain or relaxation. For many of the deeper ones, like that percutaneous type, they'll likely use imaging CT, ultrasound, whatever's appropriate during the procedure itself. That's for guiding the needle or tool accurately.
Okay, guidance is key.
Definitely. Then the doctor removes the sample, the bit of tissue or fluid.
And what about how that feels? That's probably a big question for people.
Yeah, the source addresses that head on. It says the doctor carefully takes the sample. And it specifically notes, which I think is reassuring, you might feel pressure during this, but it should not hurt.
Ah, okay. Because of the numbing medicine.
Exactly. That's why they use it. After the sample's out, the doctor will apply pressure to the area to help stop any bleeding. And if they had to make a cut, they might use stitches, maybe skin glue, or special tape to close it up. Then clean bandages over the site if needed.
That detail about pressure, not pain, is really helpful, I think. So what about right after it's done? What's the immediate recovery look like, according to the source?
Well, if you had any kind of anesthesia or strong sedation, the medical team keeps a close eye on you while that wears off.
Makes sense. Standard recovery room stuff.
Yeah. And for some specific biopsy types, you might need to lie still, maybe in a certain position for a little while afterwards. But the source points out something encouraging. Most people can go home the same day.
Oh, that's good to know. Not necessarily an overnight stay.
Often not, no. And then, of course, there's the wait for the results. When do those usually come back?
Yeah, the waiting part.
The source says results are generally available within a few days to a week, most often.
Okay, not too long usually.
Usually. But it really emphasizes, and this is super important, you need to discuss all your test results with your doctor. They're the ones who put the pieces together, explain what the findings actually mean for you and your health.
Absolutely critical. The report is just data. The doctor provides the interpretation. Now, any medical procedure has potential downsides. Does the source mention risks?
It does. It notes that your doctor will talk through the specific risks for your particular biopsy beforehand, but the general potential risks listed in the source include things like bleeding could be internal or external,
Okay.
infection at the site where the biopsy was done, and the less common may be injury to organs that are nearby the biopsy area.
Right. Risks to weigh against the benefit of getting the diagnosis.
Exactly. It's always a balance and part of that informed conversation with your doctor.
Okay, so we've covered quite a bit. We've gone through what a biopsy is, the why behind it, the different kinds based on where they are, how you prep, what happens during and right after, the results timeline, and potential risks. Feels like we've really pulled out the core info from this basics document.
Yeah, and calling it basics is spot on, like the source title says. It's foundational. And interestingly, the source itself, in a section about further reading, lists out tons of specific biopsy types: breast, kidney, liver, lung, you name it.
Oh, really?
Yeah, which just underscores the point that while the main idea getting a sample is the same, the actual details, the nitty-gritty, can vary quite a lot depending on what part of the body we're talking about.
That's a really important nuance.
Yeah.
So bringing it back to you, the listener, how can this general basic understanding be most valuable? What's the real takeaway?
I think what's powerful here is seeing this basic information not just as like a list of medical facts, but as a tool.
A tool. How so?
Well, if a biopsy is ever suggested for you, having this framework means it's not just this big, scary, unknown thing anymore. You have a starting point. You can understand why they're thinking about it, maybe why they chose a specific type, what the general flow might be.
Right, it demystifies it a bit.
Exactly. And as the source implies by being patient education material, this understanding helps you have better, more informed conversations with your doctor or nurse. You can ask specific questions about your situation, your recommended biopsy, instead of just feeling completely overwhelmed or, lost in the jargon.
That really is the key, isn't it? It's about shifting from being maybe a passive recipient to an active participant. Understanding these basics isn't about becoming a doctor overnight.
Not at all.
It's about being equipped to engage in your own healthcare decisions. Something maybe to think about next time any medical term or procedure comes up. Just how much a little bit of foundational knowledge can change the whole dynamic of that conversation.
Absolutely. Knowledge really is power in these situations.